Hello everyone, welcome to day two of Stop Diabetes campaign, and hope you got some value from day one of the session, the cost of diabetes. Today we are going to discuss disease versus disorder. So let's get started. So, what is disease and what is disorder? Medical terms, disease is something like it has a finite set of symptoms which doctors use with certain signs and uh, do certain tests, and you have a finite set of biochemical parameters or pathological features, okay, and defined rules of management and our surgical procedure that is usually called as disease. And what is disorder? Disorder is like a simple imbalance. Say, for example, diabetes, though we call it in medical terms as a disease, but the way we holistic coaches see it as a disorder, that means it is reversible. So your insulin production is not up to the mark, could be due to so many reasons. In type 1, it is different. In type 2, it is different. We are talking about type 2 now. So it is a simple disorder, and that can be managed no matter how long you are suffering with diabetes, or of how many medications you are using and how many complications you have. It is possible to reverse that. That's what holistic approach is all about. That's what the coaches, your coaches, are going to do. So to understand this, let's get to a story, because I told you that I keep telling stories. So Adi Shankaracharya is an Indian ascetic, a monk, and he is well known, right, hundreds of years back. So he keeps telling that the world is an illusion, Maya. Okay, not everything that you see is real. And so one day he takes a dip in the sacred river Ganga and is coming up. And suddenly, a Chandala, that means an untouchable man, having a group of dogs, um, confronts him. And Adi Shankara says, right, get away from me. And then that Chandala says, what are you saying, right? Who are you discarding? The God in me or me? Then, if you are discarding me, that means if I am not real, I mean, if I am real, and as you say that everything is an illusion, then I am also Maya. And the sacred river that you took a dip in is also Maya. So then Adi Shankara realizes, though he is a revered man and very learned man, and his knowledge is par excellence, uh, there is no one who can debate with him in the Vedas or Vedangas. Then he realizes, so yes, I am not able to practice what I preach, and I am unable to come out of my own illusion or Maya. So diabetes is like that. Okay. So what is this illusion, and why only in the form? Because sometimes it needs an extraordinary or out of the box approach. That's what we as coaches do, right? So what happened here is the way we perceive things depends upon the reality which we see in the world, because senses and perception, whatever our eyes see and whatever our ears hear, mind try to process it, and it needs a frame of reference. And the same thing, uh, repeatedly, if it is occurring, then we consider it to be real. Yes, is diabetes real? It is real. The sugar levels are high. Yes, they are high. And HbA1c is very high, and there are complications. Hmm. And people suffer with a lot, with diabetes a lot, because of its complications and all. So, how is it? The same thing happened again with Adi Shankaracharya Swami. One student asked him, right, why we are born as kids, grow older, and die? Because he said, because people see, right? This is a very important question, because people see that people are born young, grow old, and eventually die. That means what essentially he's saying is we are repeating, right? We are just copying whatever we see in the world. So it happened with me a few years back, and when I tried to do a diabetes reversal, almost 2014, 15, in those days, 7 years back, I tried to do a campaign on diabetes reversal, and I posted it in social media, and my account got blocked because in those days, diabetes is considered not reversible. But these days, you see, uh, everyone talks about diabetes reversal. How is it possible? Because the moment we change our perception about things, so everything changes, right? So we are what we repeatedly do, and we keep saying that I have diabetes, I have diabetes, I have a kidney problem, I have hypothyroidism. The moment you say that, your body perceives it to be real. Okay, I'll give you a simple example. All of you close your eyes for a moment and try to do this thought experiment. Imagine there is juicy lemon in your hand. Feel the aroma, feel the texture, and cut it into two pieces and open your mouth and squeeze it in your on your tongue. What happened? So most of you, those who have very good imagination, might have felt saliva in your mouth. Okay, that means there is no lemon. It's all there in the way we perceive, the mind perceives, right? Even though there is no lemon in your hand, you did not squeeze and you did not have the juice, but still you salivated. That means the way we perceive things is totally different, right? And the way the brain processes it is totally different. It's all about like instructions. If we can change our perception about diabetes, it is possible to reverse. So that is the theme of today's class, that it is a simple disorder. If we can train our mind, and it is quite possible for us to get rid of diabetes easily, but it takes time. Okay. Now, if that is so, right, why people are suffering with? Again, just a thought experiment. How life is created, right? If there is a small cut on your hand, and you go to a nurse, and what did they do? They give you a TT shot, an antibiotic, and a painkiller. Since it is not a deep cut, you don't need stitches. So only these three. And which drug do you think is going to heal your wound? TT, antibiotic, or painkiller? The answer is D, none of the above. Okay. TT is required, antibiotics are required to prevent infection. And painkiller is painkiller. Who is healing? Who is repairing the skin, bringing back it to normal condition, normal level? The body knows, right? So that means body knows how to repair itself. And to understand this, we need to understand another concept, that is creation of life. Where does life start? I mean, all of us start with a single cell in our mother's womb. We can't even see with a naked eye. A single cell, microscopic single cell. We call that as zygote. And that cell divides into two. This two into four, four into eight. That's how it divides. And over a period of time, one cell decides that, okay, I want to become brain, and it becomes brain. And another cell says, I want to become bone, it becomes bone. Okay, another cell says that, okay, I want to become blood. So from a single cell in mother's womb, we become trillions of cells, colony of trillions of cells specialized in doing all the activities, right? The body precisely knows how to maintain the pH balance in the blood, when to produce antibodies, how to fight infections, and how to secrete enzymes, how to make hormones, everything. That means, where is this intelligence, right? From a single cell, how a human body is created. Where is this intelligence? It exists innately in each and every cell. Imagine you're an architect of a huge building. Because of an accident, one part of it is got damaged, and they call you back to repair it. As an architect, is it possible for you to repair? Yes, it is possible for you because you are the person who created it in first place. So here the point is, if body knows how to make a kidney, how to make an eye, how to make a liver, enzymes and the pancreas, don't you think that it is capable of repairing on its own? It does. But only thing is, say, coming back to the same architect, though you gave him money, I mean, the architect got the money to repair whatever it is. He went to the market. There is no sand or cement or material available or masons available, but he has got money. Can he repair it? No. So you need right kind of raw material to heal or to repair the building. Similarly, our body needs right kind of nutrients to heal ourselves. If you look at our eating pattern or a period of time, okay, so what happens? Our body is made up of food we eat, our body is repaired by the food we eat, our immunity depends upon the food we eat. Okay, that means we are what we eat. And if we are becoming if we are becoming sick, that means the food we are eating is not right. Okay. And if you look at country, according to rough estimates, there are close to 100 million in India alone, diabetes suffering, right? Unknowingly and unwantedly, painfully, which is not at all required. So the point here is, we as a nation don't know how to eat. If we know how to eat, that is what is reflected in the statistics. Okay. And US being the richest nation, suffering with lots and lots of cases. It's the number one in cardiac diseases. That means we as a community or a society forgot how to eat. So that is where the science needs to come. So if this is the case, why the doctors are not able to reverse it? Why not? I mean, why it took so long for them to accept that it is reversible, and why people have to suffer with so many complications? Good question. And whether other practices they work in this or not. But here, one thing we need to understand is, a doctor can do, right? Any doctor, whether it is MBBS or a postgraduate or a super specialist, any doctor can help reverse it. But the problem is, the moment we don't take responsibility for ourselves, right? Every doctor asks a diabetic patient to do three things. One is watch your weight, do exercise, meet your dietitian about your food. Three things. But we are interested in the fourth one. What is it? A pill. Okay. So we think that taking a pill is is going to control completely uh, the sugar level. Okay, and we are done. But remember this: you have a plumbing problem in your house, and you call the plumber, and he fixed it. And by evening, again the problem repeated, and you called him again. It is happening every day, morning, evening. And the plumber is coming every day. And this time there is a problem in the afternoon as well. So he is coming to your house three times a day to fix it. Okay. Imagine the situation. That is what exactly we are doing if we are trying to manage diabetes only with medication, right? Listen to your doctor, go to your dietitian, and if you manage your weight and if you follow your fitness regime and if you eat responsibly, then it can be managed. So, what is this responsibility? Responsibility is the way allopathy developed is by looking at patterns, right? We as doctors spend a lot of time in studying human sickness, right? Where exactly the problem is. And a postgraduate is one who spends 3 years of his life, especially in India, and that too in government colleges, wherever they are. 3 years of life, they don't know when they are eating, when they are sleeping. They spend hours together in hospital. They don't have a life, right? And after post graduation, to do super specialty, you have to spend another 3 years studying only one subject. Say, for example, if you're going to a cardiologist, they study exclusively about heart, and an endocrinologist studies exclusively about hormones. That is the kind of effort they put in, right? So, and we have the audacity to think that by paying 300 rupees or 400 rupees as consultation fee, we can get all the knowledge from them, and we just want solution like that. So is it them or is it us, right? Even though they say, because their time is valuable, right? A doctor can do anything. Just remember, um, there is a friend of mine, doctor, who cracked civil services. He's all India ranker number one. Okay, 2009, I think. Okay, I used to be roommate. We used to stay in the same room. Um, and there is one doctor in Maharashtra who's a district magistrate, a collector, and throughout the COVID epidemic, he is the one who brought down the spike just like that. Okay, what I mean to say is any doctor can solve your problem, but only thing is we need to take responsibility for our own actions. Just uh, 2 minutes or 5 minutes, okay, for your 300 rupees, even a maid would not come, okay, to your house to help you. But with that consultation fee, we want our problem to be solved, and taking a pill, that is lack of responsibility. So even to go to the second floor, we choose to use elevator just because we are paying maintenance if you are living in an apartment or society, something like that. So the moment you take responsibility for your own actions, about your food, about your weight and all, when we do that, it is quite possible. But we don't want to pay doctors more, right? Yes, the question arises, but hospitals charge a lot. See, there is a difference between investment and expenditure. Your body has become sick, it is going through complications. The doctors have to rescue you from your condition, okay? And it takes money. So you are spending money to recover, right? But you are not investing your money to create health, okay? That is taking responsibility, okay? If you are told you are not diabetic or you don't have heart problem or cholesterol or thyroid, would you still go out for your walk? How many of us does that? Okay. And I see, I mean, in Hyderabad, we have a few places where people go for walking and all. I look at them and one of my doctor friend visiting me, and I told him, if any of them knew that exercise is not required to manage their diabetes or cholesterol or thyroid or anything, none of them would have been here. Nobody is enjoying their walk. Okay. That is taking responsibility. Small things, little things like this. Right? It's not that the doctors can't, but can you afford the time of a doctor, of a specialist for 1 hour? Okay, you give them time, you pay them and compensate them adequately for their time. Each doctor will sit with you for 1 hour and explain you everything. But we are not doing that, and their job is not that as well. Their job is to save lives. So that is the reason why they have coaches, dietitians in their team. Okay, and the dietitians that uh, you have, I mean, all your coaches, I don't call them as dietitians or counselors, but as coaches. As I said in the previous session, day one, a coach is someone who walks with you, right? And I refer to them as Bhudevi because they have a lot of patience. And you will be seeing some of the testimonials of what they did on the final day, where the kind of patience they have and the kind of details they go into in understanding your condition. They give you a lot of time. They'll be after you. Okay. Whether you fail, fall, they're there to hold your hand. It is difficult. I mean, they say old habits die hard. It is difficult to change our habits. It takes time. Okay. They are not going to do magic with you, but as I said, their effects are going to be magical, right? Because they help you create health. The moment you change your habits, everything changes. Okay. So, simple thing. There is a saying, an apple a day keeps the doctor away. But we follow that blindly even in India. We don't know where did it come from and why people follow. There is a wonderful WhatsApp forward about a joke about how people follow blindly. That there is a commanding officer in a camp, in a military camp, and two guards are guarding a, what is this? A bench in the park. And he was perplexed why they are guarding this. So he asked his previous commanding officer, called him, and no, I don't know the previous officer since his time. It is a custom. So he finally able to go three generations back, and the general who is retired, he's able to reach him and ask, "Sir, you asked to guard the bench. What is?" And he is shocked. I mean, is the paint still wet even after 100 years? So this is what our life is, right? We do certain things out of convention, courtesy, okay, and we don't actually see the reason. Okay. And these coaches, with their patience and with their time, are going to change or create health. So you can always recreate. So as I said, allopathy is one of the very new sciences. I mean, when it started and all, but it still got stuck in therapy. I mean, for emergencies, there is no doubt there is no better science than allopathy. And rest of the practices, I should not comment on them because I don't know anything about them. But if they exist, there must be a reason. Okay. And what we are doing as coaches in this program is helping you understand yourself. It is not about which practice do we follow and all. It's all about you. Okay. As we did a thought experiment with lemon, the same thing. All that matters is you. And they help you in understanding yourself, right? If you're eating something, why you are eating? If you're not eating something, why you are not eating, right? And there is this wonderful experiment, hypnotic experiment, um, that uh, a person was hypnotized and asked to open his mouth, and he was told that I am pouring sugar liquid in your mouth, but actually what was poured is salt water. And when he one was asked what is the taste, he said it is sweet. Okay, that is the programming the brain is capable of, and that is what they're going to do with you. I mean, I'm not saying that they're going to hypnotize you or anything like that, but it is quite possible with practice, but it takes time, at least 3 months of your time. If you can invest 3 months of your time, that is what when I said you need to invest, right, on your health. So time, effort, patience, okay, of course, money. It requires the moment you do that, and it is quite possible to reverse the diabetes. Okay, but we don't have that much of patience and all. We all want quick fixes just like that. So that is actually the problem. That's why I call the team as coaches, not as dietitians. Or yes, I mean there is clinical nutrition aspect as well. They follow scientific rules in preparing your diet plans and all. They do give diet plans, but most importantly, um, as I explained, if there are two people, one is happy and one is sad, who is going to digest the food better? So you need to be understood, right? There are 7 areas of life which these coaches are going to cover, and they'll be asking a lot of questions, spending a lot of time, and help you create right kind of balance in your weight, in your stress levels, and diet, and everything. So the cost of it, right? We uh, usually don't realize the value of something unless and otherwise we lose it. So there was a debate in our doctors group. How much does it cost to create a simple egg, right? Which we get it for 5 rupees or 6 rupees. The amount of protein and nutrients that we have, it would cost more than 1,000 rupees if you want to create artificial egg. Okay, and say for example, your kidney has got microfilters called nephrons. So these nephrons, uh, they do an amazing job of filtering the blood, taking out all the toxins, and send back the normal blood into the system. And we have millions of them free of cost. We don't know the value. Okay. And the kind of work it does, until and otherwise the kidney is damaged, which is one of the costs that we incur as a diabetes patient. The kidney gets damaged. The moment it got damaged, the amount of money it takes to filter our blood through dialysis, or through replacement kidney transplantation, and most importantly, the pain involved with that, the suffering that is involved, that is the cost I'm talking about. So circling back to the first lesson, the cost of diabetes, and ending here. So the same thing with our eyes, and diabetes is the mother of all complications in our body, whether it is energy level or gut health or heart disease, everything, starting from neuropathy. I told you the story of businessman and barber in the first class. Those who haven't, please go through the first class again. That the cost involved, right? So there is a wonderful saying: intellectuals solve problems, but geniuses prevent them. So we don't apply that in our day-to-day life. We take it lightly. Okay, taking one tablet, there is not much of cost. The doctor's consultation is cheap. But you are paying a lot with your health, with your emotions, with your mind. So the body is an amazing system. I wouldn't call it as a machine, right? We reduce our body parts to different machines. So body is not a machine. Got it? It is a system, an intelligent system. An intelligent system in the sense, just like how the body is created and how it can repair on its own. Okay. So we don't have to do anything. We just have to create the right kind of environment. Right? Environment in the sense external environment and internal environment. Internal environment is your blood. So why do we test blood? That is the internal environment. Blood circulates throughout our body, and we do test blood tests to understand what is the internal environment like. Similarly, the external environment, the kind of people we interact with, the kind of work we do, the family, the pressures, the work, okay, and how we perceive things, that is our external environment. Both of them need to get balanced, right? So body is not a machine that needs to be fixed. It needs to be provided right kind of environment, both externally and internally. So the question arises, out of all the people, those who are eating whatever they want, and but why only me? Why me? Diabetes to me? This question I'm going to answer in the day three video. And thank you all very much for going through the class. Remember, it's in your hands. Thank you.